This presentation is on MERS, Middle East Respiratory Syndrome, and is being presented by Asia, Nick, Tristan, and Alicia. The introduction and geography of MERS. MERS is the Middle East Respiratory Syndrome. The first known case was developed in 2012 in the Middle East. Most cases have been found in or near the Arabian Peninsula, although 27 countries have been affected globally. These countries include the United States, China, Germany, the United Kingdom, and Korea. Cases in these countries have all been linked to travel in or near the Arabian Peninsula.
Middle East Respiratory Syndrome originated in bats and was then transmitted to camels, which are now the primary reservoir. Contact with virus-carrying camels, specifically dromedary camels, is the most common cause of infection in humans since the virus replicates in the nasal epithelium in camels. Transmission from bats can also occur, though human contact with bats is typically limited, unlike contact with camels in the parts of the world where MERS is prevalent. MERS can also be transmitted between humans, but it is fairly uncommon due to the fact that in humans it replicates in the lower respiratory system. For this reason, human-to-human transmission mostly only happens in healthcare settings. This chart shows the multiple paths of transmission of MERS as well as the ways in which it could spread globally. Luckily, due to the low chance of human-to-human transmission, outbreaks of MERS have typically been kept under control. Of the well-known coronaviruses, COVID-19, SARS, and MERS, MERS is by far the deadliest, with a mortality rate of 34.4% between 2012 and 2019. Luckily, despite this astounding number, due to the rarity of human-to-human transmission of the Middle East Respiratory Syndrome, there have been only a few outbreaks since its discovery. The largest outbreak was in Saudi Arabia in 2014, and the only major outbreak outside of the Arabian Peninsula was in South Korea in 2015. This chart shows all of the outbreaks of MERS that have occurred in the Middle East since it was discovered in 2012.
The agent of disease is the MERS-CoV virus. If you look to the right, you can see an illustration of what the virus looks like. This virus attacks the respiratory system. Infection of the target cell is initiated by the virus attachment to the cell surface. The virus uses a protein to bind to two host cell surface molecules, dipeptidyl peptidase 4, or DPP4, and sialic acids. DPP4 is the function receptor of the virus, and its absence renders cells resistant to the virus. Symptoms for the Middle East Respiratory Syndrome typically appear around 5 to 6 days after exposure. However, symptoms can appear in the 2 to 14-day range after exposure. There are a number of symptoms that may appear with MERS. Some common symptoms include fever, sore throat, coughing, and shortness of breath. Some less common symptoms include diarrhea, nausea, and vomiting. In some more advanced cases, patients may even experience pneumonia and kidney failure. As with many illnesses, older adults and people with underlying conditions are at higher risk for severe illness. Now let's take a look at the diagnosis. The case definition includes a patient with a fever, a cough, and hospitalization with suspicion of lower respiratory tract infection. But because MERS has similar symptoms to other illnesses, testing is needed for a proper diagnosis. Tests include a kidney function test, chest x-rays, and polymerase chain reaction test of blood and respiratory samples. The PCR test takes about 2 hours for results.
Treatment of the MERS virus. Currently, there are no vaccines available to treat the MERS virus. Also, there is no recommended specific antiviral treatment. The only medical care available to relieve the symptoms of the MERS virus include breathing tubes, mechanical ventilators or respirators, and intravenous fluids, but these are only likely to be used in the more severe cases. The biggest threat to eradicating the MERS virus is the variability and inadequacy of the infection control, mainly in the Middle East.
Since there currently aren't any vaccines or other treatments for MERS, all we can really do is take personal action to prevent ourselves from catching it. So this includes avoiding personal contact with anyone who might have been possibly exposed, whether they have traveled in or near the Arabian Peninsula lately, or if they've been in close contact with someone else who has. If you yourself are traveling in that region, you want to make sure you do things like you wash your hands often, you avoid touching your face, you cover your nose and your mouth when you're sneezing or you're coughing, you avoid contact with camels since they are the primary vector, you stay in if you're sick, and you avoid large crowds or gatherings. So looking at this list, we can definitely see a lot of similarities between these actions and actions that people all over the world are taking today to make sure that they don't catch COVID-19. And while these may seem like very small actions, they are actually going to make a great deal of a difference when it comes to people catching a virus like MERS or COVID-19 or not.